Usual, I'm joined by Dr. Joe Canner from the Louisiana Department of Health, Office of Public Health. He will walk you through some updates to the COVID dashboard that are being made today, and then answer whatever questions you might have. Yesterday, I returned from Washington, D.C., where I was able to attend the inauguration of President Biden and Vice President Harris. And certainly it was an honor to represent Louisiana at that inauguration. And I will tell you, it was a surreal experience because the number of police officers and soldiers outnumbered the number of spectators. And I do hope and pray that that never has to happen in our country again. But he did speak at length about bringing the country together and achieving more unity as we face together and overcome the many serious challenges that are facing our country. And obviously, I look forward to working with him and with the Vice President and their administration in order to do that, just as I have worked in good faith with the two previous administrations since I've been governor, both President Obama and President Trump's. President Biden has already taken several key actions on the COVID-19 response. I and my team have been busy reviewing these actions. They've all happened over the last day or so, and so we're still gathering information, and there may be additional guidance coming from the federal agencies as to how these things are going to be implemented. But there are a couple of key aspects that I did want to highlight. First, the President's waived the local match requirement for much of the critical work related to our COVID response here in Louisiana and around the country. You may remember that last August, as soon as our state reached the monetary threshold for asking for relief from what is, under the Stafford Act, a 75-25 cost share, 75% federal government, 25% state, we met the threshold to go to 90-10. And we made that request, and that's the most that we can request. However, the President is able to go to 100 cents on the dollar. He has elected to do that. That is very helpful to us, and we're still trying to figure out all of the categories of assistance that are available with that enhanced match. But we do know that it covers Title 32, which is the National Guard, having those on active duty, and so that's been going to be very, very helpful to us, and we're going to continue to work to see all the other areas where 100 cents on the dollar will be paid by the federal government. Obviously, I'm very pleased with the news that we got in this respect. Second, the President established a health equity task force to address many of the inequities that the pandemic has brought to the forefront as a result of the disparate impacts of COVID-19 on individuals, and you can see that here in Louisiana as well. And you may remember that in April of last year, here in Louisiana, we saw what was happening in terms of the people who were being infected, having serious cases of COVID-19, and the impact on deaths, and knew that those deaths were not representative of the population as a whole. And so we created our own health equity task force. And so I'm glad that he did that at the federal level. And I'm going to be working to make sure that whatever they do at the federal level benefits us, but also the fact that we've got a head start on them, we need to share our information with the federal government as well, so it can inform their work product. And we'll be making sure that we're interacting with them at the federal level. It is very apparent both here in Louisiana and nationally that we may remain at a very critical point in our COVID response. Nationally, you can see the number of deaths that are accumulating every day, the number of people in the hospitals, cases that are developing, percent positivity, all extremely high. Today, we reported 1,937 new cases on 29,077 tests. Sadly, we're also reporting 41 additional deaths today. That's a total of 8,483 since the beginning of the pandemic. 1,747 individuals are hospitalized across the state for COVID-19. That is a decrease of 53 from yesterday. 216 of those patients are on ventilators, and that is a decrease of 17. We have now surpassed 5 million tests administered in Louisiana over the last 10 months or so since we started testing. Obviously, we are starting to see some positive signs that we've plateaued on this most recent surge. That is gratifying, but we remain at a very precarious place because the percent positivity remains in excess of 10% across the state. The number of new cases every day is extremely high. All 64 parishes that are at high incidence, meaning the number of new cases as relative to the overall population, it's in the highest category that the CDC measures. We also are at a very high level of hospitalizations, and while we're no longer at that 2,100 level where we were knocking on the door just about a week ago, I will tell you that we remain with too many people with COVID-19 in the hospital. It continues to stress our healthcare delivery system, but we are beginning to see what we hope is the formation of a trend, the development of a trend where we can continue to come down. But that's only going to happen if people embrace the mitigation measures that we know work to slow the spread, flatten the curve. The reason we had the surge is because of all the holiday-related activities, especially travel and social gatherings, where individuals did not do what was necessary to limit the spread. And now that we've passed that period, and certainly that's what we're seeing develop across the state is that stabilization on our numbers and starting to come down. The lagging indicators, deaths. That's why we've reported 100 deaths over 2 days, 159 deaths over 3 days, just unacceptably high. But hopefully, if we can keep all of our numbers moving in the right direction, those deaths will start to come down as well. I also wanted to take a moment just to talk about the variants of the virus that are beginning to emerge around the country. As you know, I think it was last week, we disclosed that we had verified here in Louisiana the presence of the UK variant of the virus. I think there are about 20 states across the country now that have this variant. It appears that this variant is more transmissible, meaning people are more contagious, and it's not more virulent, meaning it doesn't cause a more severe outcome on average. And as best we know, it will respond to the vaccines as we would want it to. The problem is, if it's more easily transmissible, then we know that more people will get COVID-19, and therefore more people will be in the hospital, more people will die than would otherwise be the case. And it is more important than ever then, especially with the modeling that shows that by March, this particular variant, the B.1.1.7 variant of the coronavirus, could be the predominant strain in the United States of America and here in Louisiana. So between now and then, we have to do everything we can to get our baseline numbers down to create as much capacity in our hospitals as possible, to minimize the number of new cases that we have between now and then, so that we will be in the best possible position to weather that storm that is being predicted right now. There are also variants that have been found in Brazil and in South America that could be potentially problematic, and I don't believe they have been discovered here in the United States yet. Because of the way this pandemic travels across the world, I think it's probably a matter of time before that happens. I can tell you that the number of samples of the virus that are being genetically sequenced is increasing, but it still remains inadequate for us to do the surveillance that we really need to do in our country in order to know what strains we're dealing with on a day-to-day basis. but the number of samples that are being genetically sequenced is at least doubling, and we're looking at ways to have more of that done in the state of Louisiana as well. So there should be some more information about that coming up soon. On the vaccine front, we continue to see progress. The information that I have right now is that Louisiana has administered 301,316 doses, and of course that obviously changed since the time that got written. And in fact, that was yesterday's update, so that doesn't account for any vaccines that have been administered today. The CDC currently ranks Louisiana as 10th among all states for vaccine administered per 100,000 residents. So vaccine utilization, they have Louisiana at number 10 in the country. We're certainly not satisfied with where we are. We're going to continue to improve and become more efficient in the way that we distribute and administer the vaccine. But the limiting factor for us, as it is for every state, is simply the number of doses of vaccine being allocated to us on a weekly basis. You're going to get some information from Dr. Cantor in just a few minutes, but we've basically been flat on vaccine allocations over the last 4 weeks. And our plan as a country and as a state is premised upon increasing allocations over time, obviously. I still believe that's going to happen, but it's been a little bit slower than obviously we would like. We wouldn't be where we are without an awful lot of people working extremely hard, to include not only the people at the Department of Health, but we have pharmacies and hospitals and clinics and community organizations. We have the National Guard. We have so many different organizations and individuals working very, very hard, and I want to just thank them on behalf of all of the people of Louisiana. I'm encouraged by the progress that we're making, and I know that we have a long way to go. And as I mentioned, the biggest hurdle we have is that the demand clearly greatly exceeds the supply. That's actually in some ways a good thing, because it tells us we have a lot of people in Louisiana who desire to be vaccinated. And I can tell you there's still too much hesitancy around the vaccine in Louisiana and elsewhere in the country. But the number of people, the percentage of people who are vaccine hesitant appears to be diminishing over time, as it should, because we know the vaccine is safe. And I'm talking about Pfizer, I'm talking about Moderna, because they have been granted EUAs. But I will tell you, in the future, any vaccine that is granted an emergency use authorization is safe and effective. Otherwise, it wouldn't be given that EUA by the Food and Drug Administration. So they're safe and they're effective, but are also the only way that we're going to put this pandemic behind us. So it is good to see more people wanting to be vaccinated. So we're anxiously awaiting increasing allocations, and we're gearing up now to prepare for those increasing allocations, so that while we're not doing mass vaccination events currently, we are planning and preparing for those. In fact, that's not anything new to the way Louisiana operates. And by the way, we hope, and this is something I heard Dr. Fauci speak about yesterday, that the next vaccine comes online and may be available for administration as early as the beginning of March. And that would be the Johnson & Johnson single-dose vaccine, which would be a game changer. And of course, we can't get too far ahead of ourselves, because the clinical data is being put together now, and I think in a couple of weeks they're going to be submitting that information for that emergency use authorization. But that would obviously be very, very helpful to us to bring on a third vaccine and have an additional allocation of a single-dose vaccine, so that when those individuals receive that dose, they are vaccinated. And of course, we'll have to monitor whatever the Advisory Committee on Immunization Practices comes up with as recommendations for that particular vaccine, but it should be very helpful. But there's a lot of talk out there about mass vaccination events, and we hear it locally, we hear it nationally. And typically, the story goes that they have a venue, they've got everything set up, they're ready to go, they just don't have the vaccine to be able to execute in the numbers that they would like. And as a result, we're not even trying these mass vaccination events in Louisiana yet. because in order to resource them with vaccine, we would literally have to stockpile vaccine over a period of time. So we wouldn't send it out to our enrolled providers so that they could be administered as soon as we receive it. We would be holding it back in order to put it together to do a mass vaccination event. Well, that defeats the purpose of trying to have as many people vaccinated as soon as possible within the priority groups that we've established. Now, we do look forward to having some mass vaccination events when our allocations increase and we're able to do that, but it's not something that you're going to see immediately. Now, we do have some partners out there, particularly hospitals, that will have the flexibility to take their allocation of doses and go out into the community as opposed to administering those on their campuses. And we're going to be working through that as we move forward. But I did want to take just a moment to speak about mass vaccination events and why you're not yet seeing those in Louisiana. It would literally slow down the administration of the vaccine in our state were we to undertake those at this time. That brings me to today's announcement. LDH is adding a new dashboard, new data to its dashboard. It's about vaccinations. Now you will be able to see more information about the number of doses that we have administered across the state, who's getting the vaccine in Louisiana by region, by age, by gender, by race. And then just as the COVID dashboard evolved over time and became more granular in the data that it presents, that's going to happen on this dashboard as well. It's critical information that we know where we are and how to target our future efforts, and this is going to be helpful. But we also want to be as transparent as we can be with the people of Louisiana. I believe transparency breeds confidence, and so we're going to try to do that. LEH will update these breakdowns on Tuesdays and Thursdays as part of its larger COVID vaccine updates. Now, one of the things that I will point out now that is a bit of a problem is the data that we have around race, because when you look at that, I think about 56% of the people being vaccinated are being categorized as an other or unknown. And so clearly that's not the case. And so we're going to make every effort to ensure that the enrolled providers who are administering vaccine are accurately, completely, and timely submitting data to us via links where that picture clears up. Because quite frankly, we don't really know what's happening there when it comes to vaccination by race. And one of the things that we're focused on here, not just with respect to vaccinations, but overall, is equity. That's why we formed the Health Equity Task Force. So we will be making sure that information is better represented going forward, and we'll get that fixed. The department is actively working to enroll more pharmacies and other enrolled providers in our LINKS immunization system, especially those in the underserved communities. But we're getting close to 2,000 enrolled providers. That's a lot, and that's more than the vast majority of other states who took us a different approach. But it's serving us very well because we're able to have vaccine shipped directly to enrolled providers all over the state of Louisiana. And we can be sure that every week we have vaccine going to all 64 parishes. And so we're going to continue to work it from this perspective. We will make sure that we have strike teams available so that if we see that there are areas of our state where we're not able to get enough vaccine in and administered as we would like, that we will be able to, and whether it's an urban area or a rural area, we're going to have strike teams, much like we did around community testing for COVID. We're going to be able to send in coordination with local governments, send in strike teams in order to administer vaccine. And you're going to see some of that in the not too distant future as well. So I'm going to ask Dr. Cantor to come up now. He's going to share more information on these new features. I would encourage you to direct your questions to him about these features or anything else that's happening with respect to COVID that you may be interested in, and then I'll come back after Dr. Cantor's finished. Thank you.
Thank you, Governor. Good afternoon, everyone. Hope everyone has had a good week coming back from the holiday. I'll talk a little bit about where we are with COVID. I'll talk a little bit about the vaccine, and I'll talk a little bit about a new feature with exposure notifications that we'll be launching today, which is very exciting to us. As the governor had mentioned, our numbers for COVID have begin to perhaps plateau a little bit. It's always easier to make those judgments after the fact. We're in the middle of it now, but they do seem to be plateauing a little bit. Percent positivity is at 10.3%. But as the governor said, it's very, very high. And we're thankful that it's no longer continuing to go up. Quite frankly, it would have been drastic had it gone up any farther. But transmission is still very high. This is still a very dangerous point in time for Louisiana. As the governor mentioned, all 64 parishes have greater than 100 new cases per 100,000 residents per 7 days, which according to the CDC criteria puts them in the highest risk category. So if you were to look at the map, judged by the CDC community risk transmission categorizations, all 64 parishes are deep red right now. It's been that way for a couple weeks now. There's a lot of COVID. We know that hospitalizations are a little bit of a lagging measure, and we know that fatalities are certainly a lagging measure. And as the governor said as well, it continues to be unacceptable to us. The number of fatalities that we have, really for the past few weeks, we've been reporting between 40 and 70 new deaths a day that are COVID related. That's a number that weighs very heavily on me. It's a number that weighs very heavily on everyone in the Department of Health, and I know it does as well for the governor and his team. And we know each of those fatalities, there are family members that are now grieving because of that. So I'd ask folks to keep that in mind. There still is a lot of COVID circulating in Louisiana. It still is a very dangerous time. It's still very important for us to be following the mitigating measures, and even more so now because we know, confirmed, what we presumed was true before, that the UK variant is in Louisiana. So we've identified one case. As the governor said, we send samples regularly up to the CDC. We do have a handful of samples which are in the process of being looked at and confirmed by the CDC. If they show to be positive, we'll announce that as well. But we should presume we have many more cases than the one that we've been able to identify. And what we know about this variant is that it's more easily transmissible, perhaps 50% more transmissible. We do not think it's any more virulent, meaning we don't think it's making more people we don't think it's making people sicker than they would be if they were infected with the other strand. But when you have more transmission, you just have more people getting sick because of that, because there's more virus out there. We do think that the two vaccines we have now, the Pfizer and the Moderna, are a good match for this variant, and that's awfully good news. But I'm not going to be surprised if we see our transmission rates go up even farther in the coming weeks, because we can expect this variant to spread farther within Louisiana. Everyone needs to know that. Everyone needs to be careful because of that. I'm happy to announce that we have another tool to help us with exposure notifications. This is an initiative that's being launched today, and it's an app on your phone called COVID Defense. It's available now on the App Store. It's both available for Android phones and for iPhones. And this is a exposure notification program that, in an anonymous and confidential way, will push a notice to users if they come in close contact with somebody else who is participating in the program and identified as a positive case of COVID. It's completely anonymous. It does not transmit any protected or personal health information. It does not track anyone's location. It does not feed the state any of that information. In an anonymous and coded fashion, it communicates via Bluetooth in a certain radius, And if someone is identified as positive, they will get a code, so to say, from the contact tracer that they enter into the app on their end. That will allow their phone to anonymously communicate just by Bluetooth any other participating phones within that close contact radius. And so an end user, if they do come in contact unbeknownstly to someone else who is positive, they will get a push notice on their phone letting them know that that contact happened, advising them to take precautionary measures. This is another tool. I think this is going to help us, certainly help people know that they've been potentially put at risk. I think it's going to be really useful in some settings, to be honest. I think it'll find some use in college campuses. I think other workplaces where sometimes it's challenging to go back and do contact tracing, this is going to prove to be very useful. A number of other states have started using these type of programs, and they've worked well. We've been looking at what's happening in other states, and particularly with the variant now, this is going to be helpful for us. I mean, we don't want to leave any tool on the table, so to say. So I'm happy that this is out there. It's completely voluntary. No one is required to do this. If you don't go actively download the app onto your phone, then you're nothing new happens. You're not participating. But for those who are interested, and I would really encourage you folks to do it because it's an added layer of protection. It's available on the app now. It's 100% free and 100% private. As the governor had mentioned for the dashboard, we are happy to put some more demographic information on there now. So as of today's update at noon, for vaccines administered, you'll be able to see a breakdown on a statewide basis in terms of gender, in terms of age, in terms of race, and then regionally where vaccines have gone and how many have been administered. We're going to add, just like we did to the regular COVID dashboard, more granularity to that as time goes on. I think it is unfortunate that about 56% of individuals are currently categorized as either unknown or other race. That's clearly not true, as the governor said. We're working with our vaccine providers to clean that up. We need our vaccine providers to enter in accurate information about race. It's important to us, important to everyone in the state to be able to track this, to be able to know that vaccine is being distributed in an equitable fashion. We need good data coming into us to be able to do that. So that's an ask that I'm making of all vaccine providers now, that when you do fill out information, and I know the feds ask an awful lot of information of vaccine providers, but it is really important to put in accurate information for the patient's race, because that's the only way that we're all going to be able to know that this vaccine is being distributed equitably. Looking towards the allocations that we're getting from Operation Warp Speed, unfortunately, it's the exact same amount that we've gotten last week. So by the end of this week, by tomorrow, we would have been allocated to Louisiana a total of 379,950 first doses, of which 93,600 have been directed towards the federal long-term care partnership program. That's the nursing home and assisted living facility vaccination program, leaving 286,350 doses for in-state distribution. For the next coming week, our allocation is going to be flat. It's going to be the same thing we got this week, which is 29,250 doses of Pfizer and 28,900 doses of Moderna. Just like last week, the CDC has granted us a reprieve, and we do not have to contribute any of those Moderna into the long-term care partnership program because they have enough banked up. So all of that will come to us for in-state distribution, just like it did this current week. What we've been told by the Operation Warp Speed is to expect similar allocations for at least the next 4 to 5 weeks. Unfortunately, that means that we can't be doing the very large-scale events that we've been prepping for so long. Once supply increases, and certainly once the Johnson & Johnson or AstraZeneca vaccines get authorized and become available to us, we're looking forward to doing that. For now, we're going to continue with the very broad network. We've got about 1,800 providers enrolled. As the governor mentioned, that's more than most states. And we really do think that's going to serve us well down the road. Once we have enough supply, we're going to have to be firing on all cylinders. We're going to have to be doing the big events and putting it into small clinics and pharmacies throughout the state. We've stood up the more challenging part of that now, which is this broad network of providers. We put in a lot of legwork. The team in the health department has worked very hard to do that. That's going to pay dividends to us down the road when we have enough supply to leverage all of that at one time. I am encouraged that we're moving vaccine well. Again, as the governor mentioned, CDC has us at 10th amongst states, and I want to get to number 1, but I am encouraged that the strategy we're using is working well, and I'm particularly appreciative of our vaccine providers. And these are hospitals, and these are clinics, and these are pharmacies. And they're working so hard to connect vaccine to patients. And we're asking an awful lot of them, because we don't find out how much vaccine we're getting exactly until a few days before it ships and gets arrived here. We're not able to tell providers how much they're going to get. So we're asking them to minimize waste. They've done a great job of that. We're asking them to only make appointments and not have people congregate and form lines. And we're asking them to do all of that with not a lot of notice, week on week, on what they're getting or if they're getting it all that week. They've really stepped up to the challenge, and all of our providers, hospitals, clinics, and pharmacies. So I just want to express our appreciation of what they're doing. They are the reason, along with everyone else who's coming up to get vaccinated, that the state's doing as well as we are right now. Before I take a couple questions, I do just want to reiterate that although we are plateauing with transmission, we are incredibly high. I mean, having a percent positivity above 10% for the state is still astronomical. There's a lot of risk out there, a lot of danger. I'm not convinced we've seen the entire bump from New Year's yet. And then we know that this new variant is going to be taking hold. It is taking hold, under our nose right now. So all the reason in the world for people to be cautious, and I really ask people to continue to think about, what's important to them, what's important to their family, and it just takes 1 or 2 bad decisions to have, a family member land in the ICU, and that's just heartbreaking when that happens. So I do ask people to be cognizant of that and continue to be careful. Be happy to answer a few questions if there are any. Sam?
On the race data, can you talk more about why exactly we have 56% of people in this category? Is this a matter of patients selecting a certain box? Is it providers selecting a certain box? And do all providers have more or less the same sheet? You just need to get them to fill it out properly?
It runs a number of those. At the end, the information that gets input into our link system is the same, but different providers have different interfaces for that. Some of the larger systems, hospitals and some larger clinics, have a direct linked interface with their electronic health record, and so information gets pushed. Sometimes that IT link works, sometimes it doesn't. When it doesn't, we need to go back and fix it. That's part of it. Sometimes, and this has been happening with some of the larger hospital systems, they will, kind of as you allude to, ask patients to pre-enroll their information ahead of time, and that typically doesn't get vetted too well. I mean, if a patient enters in or doesn't enter the question, then that's the error there. And then for providers that enter it in, I say manually, but I just mean in the computer directly, not on a direct feed. I think there's probably the temptation, just for expediency's sake, to click other for race and move on, because they're trying to get through patients as quickly as possible. And we do ask a lot of them in terms of information. So I just want to communicate with providers how important it is for that piece of information, because we have no way to track this, which is an important measure to track unless we get the good information. So it is kind of an all of the above answer to that. And just like the data, if you'll remember, way in the beginning when we started the COVID dashboard, there was a lot of noise in that data, and we cleaned it up in time as we were able to communicate. I expect that to happen here. So I want to see that number, that 56%, get lower and lower each time.
Have you seen that improve since you guys sent out that memo to providers telling them not to click other?
That was just, I think, Tuesday, so I don't think enough time's really elapsed. Yeah, but I do next week. I really hope to see it improving. Yes, sir.
How are the allocations determined?
Well, it's a process. We do our best job to direct it proportionally based on where people live and what the populations are. And the parameters around that have changed a little bit. We're in week 6 right now. Next week, I think, will be week 7. And back in the first couple of weeks, we were directing it primarily to hospitals. So they went to where the hospitals were, for the frontline healthcare workers. And then we began standing up this network of community providers, pharmacists, and clinics. And so for the first couple of weeks of that, we, in some cases, were limited to where enrolled providers were. Now that we have the network pretty robust, I mean, I think close to 1,800, I believe, across the state. We're able to select more, and some providers are more able to handle Pfizer, have ultra-cold storage than other ones. So I think week on week, you're going to see it reflect more specifically the population of that area, and that, that'll become apparent week on week.
So is this number what Louisiana has requested from the federal government, or is it?
I wish that the situation was that we would make a request and then the feds fill it. What actually happens is every week the federal government tells us what we are entitled to, and then we place those orders. And we, as you would imagine, order exactly the amount that the feds have offered to give to us.
And they tell you that based on local providers?
That is based, that to date has been based on population. What the federal government has done is take some vaccine off the top, so to say, for federal interest, VA hospital, Department of Defense, other things. Of the remaining of the lot, they do a calculation based on the percentage of state residents who are above 18 years old to get the vaccine. And I believe the Louisiana percentage was 1.46% of that total number. That was the calculation used. That's what's been used to date. There's been some suggestion by the previous administration that they would be transitioning to a more incentive-based allotment where they would allot it towards states who are using quickly a greater percentage of that. If that did happen, I think Louisiana would be advantaged because we're number 10 in states right now. I've not gotten confirmation that the new federal administration is going to do that or not. Yes, sir.
Despite everyone's reassurances that the vaccines are safe, hospitals in the Baton Rouge metro are telling us that nearly half of their healthcare workers have declined the COVID-19 vaccine. Is that concerning?
It is. It is. I think part of that is probably deferred or delayed. I've heard a lot of healthcare providers say that they wanted to wait a little bit and see other people get it. I would advise them not to. As you know, right now there's not really enough vaccine to be able to expand the eligibility, but that soon enough we will. And I don't want healthcare providers, if they want to get vaccinated, I don't want them to jeopardize their opportunity to do so. So it is a safe vaccine. It's an efficacious vaccine. It really, I mean, as far as vaccines go, the two we have now are really home runs. And it does pain me when a healthcare provider who is putting themselves on the line has, given so much to their patients that they deprive themselves of that opportunity.
That's just the Baton Rouge metro. Checked around the state to see if other hospitals and other cities are lining up with those same figures as well?
Numbers I've seen or have been told anecdotally vary. And some hospitals have gone well above that, and some hospitals below that. It's been a mixed picture. Yep, Sam?
Oxford, obviously this week had to cancel and postpone a lot of appointments related to supply issues, and it looked like they overshot how much vaccine they were going to get. Are you changing how you're coordinating, or are you advising providers at all to avoid kind of mass postponements of appointments like that?
We are. I think what happened there is the institution really leaned in, I think, and tried to line things up. And there was some confusion because of what was announced by the White House, and that there was a suggestion that a bunch of stored vaccines were going to be made available, and a lot of states got very excited about that. And then within 1 or 2 days, it came out that there actually wasn't anything else available. And I think that's really unfortunate. We've been as clear as possible from our perspective that we don't think our allocations, we have no reason to expect our allocations to increase substantially over the next 4 or 5 weeks. Maybe, the Fed said maybe 5%, maybe even 10%, but nothing substantively. And so we're trying to communicate as best we can to providers that not only we don't think we're going to get substantially more vaccine in the near future, but we are trying to allocate to the whole state. And just because a provider got some amount 1 week, unfortunately, we're not able to guarantee how much they're going to get the next week because we're not going to find out until a few days. I think that's probably what happened there. I mean, I'm encouraged that providers are leaning in on this. I'm encouraged that there's so much demand. And once our supply meets that, I think we'll be in a really good spot. Yes, sir.
Dr. Cantor, so you mentioned the supply being much higher, much lower than demand. What has been the biggest challenge here? Has it been the supply, or has it been trying to figure out where the supply should go, especially since we have these flawed racial numbers?
It's the supply. You know, I mean, look, it's when you have limited supply, it's always difficult decisions to make sure it's going to the best place where it can be used, you know, by the most people. But at the end of the day, we have many more providers, clinics, hospitals, and pharmacies in Louisiana who are telling us, hey, we're ready to vaccinate people. You know, I mean, give it to us. We're ready to go. And we have many more people, a lot of people who are 70 and above saying, I want it. I'm on a wait list. I'm on many wait lists. I want it. That's where we stand now. I think, again, it's at the end of the day, I'd rather have that problem than have more vaccine and have no one want to give it out or have no one want it in the first place. And I'm encouraged that when we do get more, we're going to be able to use it very effectively. I just, you know, think I'm frustrated with everyone that there's not more supply to be had right now. Yeah. Yep, and last question.
Where are we in phase 1? How much has been completed?
Well, it's an interesting question. You know, so right now we've done phase 1A and we're in the middle of phase 1B, tier 1. If you add up the eligible population there, how many people in theory, and it's, you know, it's population estimates, it's about 900,000 people. And clearly we haven't had 900,000 doses be made available to us. 1A plus 1B tier 1 equals about 900,000. So the X factor is how many people within those buckets are going to want to be vaccinated. And the general sense, the advice that we've gotten from the CDC is it doesn't make a whole lot of sense to move into a successive tier while you still have long wait lists, because you don't actually create opportunities for vaccination. You just make longer wait lists. So, you know, we keep in pretty close contact with our providers. And, you know, once we start hearing that there is some space in there, that there's a little more availability, that's going to be a signal that we move on to the next phase. Listen, everyone, I really do appreciate everyone's work here. And again, I can't emphasize enough, you know, I'm encouraged that our numbers have not increased even farther in terms of COVID transmission, but they're still awfully high, way too high for comfort, and there's still a lot of risk out there. So families still need to be taking a lot of precautions. Thanks, everyone.
Thank you, Dr. Cantor. As you can see, there's a lot of information to go over today. And I did want to go back over a couple of things. One is the hesitancy for vaccination that we saw among healthcare workers, and I think it was a question we got. That, like all vaccine hesitancy around the country in all groups, it is diminishing over time. And I can tell you, for example, that our long-term care partnerships, where we have Walgreens and CVS going into our nursing homes, when they went in for the very first clinic visit to start administering the first doses to staff and to residents, the number of staff that were actually availing themselves of the vaccine was much lower than we wanted. But now that they're going back for the second visit to give the second dose, we're seeing many more staff saying, okay, now I'm ready for my first dose. And that's obviously gratifying, and I look for that to happen across the board, and certainly it needs to, because again, the only way we ever put this pandemic behind us is to have a sufficient percentage of our population vaccinated, and we know that these vaccines are safe and effective. And in conversations with governors from all over the country, and we do this generally once a week on a video telephone conference. I had an opportunity to visit with a number of governors on Wednesday. We all are asking for the exact same thing. We want more vaccine as soon as we can possibly get it, and we want more lead time to know how many doses we're going to get, so that we can do a better job of planning at the state level, but also then communicating allocations down to all of our enrolled providers. And we have 1,800 or so enrolled providers. We don't have 1,800 entities out there administering the vaccine, but we're I think about 300 or so, about 300 right now of the 1,800. But this is the way that it works. First of all, we have been flat, basically flat in our allocations of first dose vaccines for 4 straight weeks. We find out on Tuesday a planning number for the following week. Anytime before Thursday, that number can change, but we start to plan on Tuesday. That number gets confirmed to us by Operation Warp Speed on Thursday. that is when we finalize our plan and we order vaccine, and then we start to communicate immediately with those enrolled providers who are going to be receiving vaccine. And if they get it direct shipped to them, they're going to get it on Monday or Tuesday of the following week. If they get it through our wholesale distributor in state, they're going to get it on Tuesday and Wednesday of the following week. So we're asking an awful lot of our enrolled providers and our partners, and they're doing great work. And they all want more vaccine than we're able to give them. And so on occasion, and I hope this doesn't happen often going forward, you're going to see that certain entities, and I know it happened with Oxnard, they had to call some people back and say, I'm sorry, I know you have a scheduled appointment, but we're not going to be able to get to you this week because our allocation didn't increase the way that we had thought it would or hoped it would. That's all a function of the vaccine we're getting and the amount of time we have from the time we know what that weekly allocation is until we can communicate that to our partners. But they are all doing extremely good work. And on behalf of the people of Louisiana, I want to thank them because we wouldn't be where we are without them, no way. And we got a long way to go. And they are going to be very key to our overall success as we move forward. And like everything, I mean, it seems like we've been doing this a really long time. Our first vaccine was put in to an arm on December the 14th. So we're just over a month into what is going to be well, I don't know how long this is going to last, to be quite honest with you, but it's going to be many, many months. So I did just want to go through that very quickly. The app that Dr. Cantor mentioned, I just want to make sure people know that it is free, it is voluntary, it is completely anonymous, and it allows you to reduce potential exposure risk to your family, your friends, your neighbors, coworkers, and others. And it is available at the App Store. And you go to coviddefensela.com, coviddefensela.com. This is an additional tool. This doesn't replace anything. It doesn't obviate the need to do away with masking, distancing, washing your hands, staying home when you're sick, any of those things. Those things are incredibly important. And probably because of the emergence of these various variant strands of the virus, more important than ever. And so let's all double down on the things that we know that work. And while we're very optimistic and hopeful about the vaccine and the vaccination effort, that is the way we put the pandemic behind us, it remains the case that this mask is our best tool at present because we're limited in the number of vaccine doses we get every week. We're not limited in who can wear the mask. There's masks out there for everybody. So please do that. Let's not let up. Instead, let's step up. All right. I'll take questions now. Our next briefing, by the way, will be next Thursday. And I think we're going to, next Thursday. And I'll do my radio show on Wednesday of this week coming up because I wasn't able to do it this past Wednesday as it was scheduled because I went up to the inauguration. Also want to let you know that I'm going to be in Southwest Louisiana, particularly in Cameron and Calcasieu parishes on Tuesday to deal with hurricane recovery and a little bit of COVID work there too, and do plan to have a press availability on that trip. Yes, sir.
Doing any outreach to black communities or minority communities for the vaccine? Yes.
And in fact, there is a meeting of the Health Equity Task Force today that Dr. Cantor is going to be talking to them. And it is about amplifying the communications, the messaging to the African American community to overcome vaccine hesitancy, to promote the vaccine, its safety, its efficacy. And by the way, this is happening all across the country as well. And so absolutely key part of what we're doing. Yes, ma'am.
Governor, Brittany Weiss at WWLTV has been doing some extensive reporting on the unemployment situation here in Louisiana. Hundreds of people call our tip line and email us daily. Have you heard from LWC any concerns about the length of time it takes to pay out unemployment claims, and could Louisiana be doing more?
Yeah, well, the answer is yes and yes. we have unprecedented numbers of people who are filing unemployment claims. That's been the case throughout the pandemic. But we also have new forms of assistance that have been created by legislation coming from Congress. And it is incumbent upon us to make sure that we're doing what we can to protect against fraudulent claims. And so we've had to increase certain measures that we do to ensure that it's a valid claim, and that requires identification and so forth. I will tell you, under the most recent legislation that was passed by Congress in December, from January the 1st through January the 15th, LWC distributed more than $166 million in unemployment aid across all of those unemployment insurance programs. Last week alone, LW received just under 22,000 new unemployment insurance claims and paid $88 million in all of last week out on those claims. But having said that, and I speak to Ava Dejois and her team often, they're still doing more. They're pulling more and more people. They're extending their hours. They're working through the weekends in order to get through these claims and make sure that they're paid as timely as possible. And I will tell you, just recent, I think it was last week, the U.S. Department of Labor, the outgoing administration, recognized the Louisiana Workforce Commission as #1 in the country in terms of timely benefits payments. But having said that, and I am gratified that we're #1 in the country, we have an awful lot of people who are waiting longer than they should to get these payments, and so we're going to continue to improve. Yes, sir.
Governor, you mentioned is this the Biden administration telling you to expect flat allocations of vaccines for 4 to 5 weeks? And where did that, what is the reasoning behind that? Why? Because that's not, obviously, as you mentioned, that wasn't part of what we assumed would happen. We thought it'd be ramping up. So why are we getting flat allocations for the next month?
Well, what I can tell you for sure is, going back for the last 4 weeks, we have been basically flat. Everybody was working under the assumption that over time the manufacturing output would increase and allocations would increase as well, and that we would be ramping up the number of doses that we were administering, especially first doses. And I do want to just stop for a second and make sure that everybody knows we are holding second doses. So the second doses are absolutely available in Louisiana. If you receive a Pfizer first dose, then 3 weeks later you get your second dose and you go to the same place. In fact, you're making your appointment at the same time you receive your first dose. And if it's Moderna, it's 28 days later. And so we are absolutely holding those doses. And so when we talk about stagnant or flat allocations, we're principally talking about first doses out there. So they have been flat for 4 weeks. We've been told, and this is recently, so this, if you go back and look at representations that were made back in November and December, we always believed that there would be increasing allocations. That is going to happen at some point. It just isn't happening yet, and that presents some problems, as you can imagine. But we have been told that the allocations will be relatively flat going forward for the next 4 to 5 weeks as well, and then hopefully those allocations will start to increase, and that is the limiting factor, not just here in Louisiana but around the country. If you just look and see what's happening, no matter what model a state has implemented for vaccine distribution and administration, nobody can administer a vaccine dose that they don't have. And so that is the limitation, and it's my hope that they'll be able to speed the ramp up in production. Well, Sam, we're getting, as best I can tell, 1.46% of what's being made available to the country. So I can only assume, or is it 1.64%? It's one of those, because that's our pro rata allocation. So I can only assume that the manufacturing coming out of Pfizer and out of Moderna that is being made available to the United States of America is flat. I mean, that's the answer. Yes, ma'am.
Are you concerned about the impact in Louisiana related to President Biden's perfect decision on the Keystone Pipeline? Louisianians are worried about how Biden's energy policies may impact jobs in our economy here. Do you have any advice on how a new administration may impact our jobs and industries here?
Well, obviously, all administrations, I'm concerned about any decision that would adversely impact our economy, investment that happens here, job creation that happens here, jobs that get maintained here. And I don't know exactly what impact there would be if the Keystone Pipeline isn't completed, but rest assured that any decision where I believe there's going to be an adverse impact to the state, I'll be communicating to the administration my concerns and asking them to take another look and change course with respect to those decisions that they've made.
Also, follow up to my other question about LWC. What do I tell the thousands of people who aren't receiving payment?
Well, first of all, you can tell them that we're working as hard as we can, basically all day and over the weekends. The backlog that the Secretary Dashwell reported to you all on January the 8th was 30,000 claims. 16,000 of those have been cleared out. An additional 80 employees from the Workforce Commission have been pulled in to help with the remaining backlog, and we're just going to continue to work as fast as we can. And look, if you're there and you need that payment in order to buy food, to pay rent, to live, there's nothing I can say today that is going to satisfy them. They need that check. I get it, and that's what I've instructed Ava to do with her team. And again, they're doing it better than anybody else in the country. But that doesn't help those individuals until they get that check. And I understand that. But we also have an obligation to make sure we're not paying fraudulent claims. And we have stopped 60,000 claims that had every appearance of being fraudulent because of the measures that we have implemented. And typically, and I just want you to understand this, if for the normal unemployment insurance program, you have an employee, and when that employee no longer has a job, you confirm that with an employer. But under the new program, these benefits are being made available to people who are self-employed. So you can't do that normal confirmation. And so you have to make absolutely sure that you're dealing with someone who is entitled to the benefit that they are applying for. And it didn't take long for the bad actors around the United States of America to know that there was a new program that had been stood up, that they were paying benefits to new categories of workers, and that traditional form of verification wasn't available. And so we had to increase the amount of identification and so forth that they were showing in order to prove eligibility for the benefits. And that has slowed down the payment of claims, but it was absolutely essential, because if I pay 60,000 fraudulent claims, then that's 60,000 bona fide claimants said I can't pay because I'm out of money, right? And so we have to try to get it all right, and we're doing that. We're not perfect. We make mistakes. It takes longer than we want it to take. I get it. But those are the things that we're dealing with. And I will say it again. Number one in the country in timeliness of claims being paid. Yes, sir.
So we've been in this almost a year now. We've been.
Seems like 10, doesn't it?
Yes, it seems so long. So I know Dr. Cantor talked about it looks like we're plateauing, that kind of thing, but the second variant, there's lots of COVID still out there. With that being said, all of us in here are wearing our masks, but there are still people out there who aren't. Can you maybe take us back in time, for lack of a better word or term, about the mask mandate? Is it state mandated, or what's the best way to describe it? Because it seems as though there's some confusion behind it.
Well, first of all, there should be no confusion, and the science is very clear that masks work. They work to slow the spread, the transmission of COVID-19, and because we know that the primary means of transmission are through droplets that are emitted when people speak, when they breathe, and so forth, when they cough, obviously, and having a mask over your mouth and nose prevents that from happening. We also know that it also protects the wearer. We didn't know that initially, but we now know that because of additional studies, that the wearer of a mask is also benefiting from having that mask on, because airborne particles from someone else don't get through the mask as easily. So the science has been very, very clear, and the CDC recommendation on this has been very clear. It wasn't early on, if you remember, at the very beginning of the pandemic. And I think, I don't know that it was ever a statement about the efficacy of masks more than it was about the fact that there was a scarcity of masks, and we wanted the masks that were available to be allocated to frontline medical workers, people at hospitals and so forth. But as soon as the supply of masks started to catch up, and they did some studies, the CDC has been recommending that people wear a mask. And that recommendation is for all 50 states and all the territories. And in addition to that, the White House Coronavirus Task Force recommended mask mandates, especially in states like ours, where we have unacceptably high positivity, transmission, new cases, and hospitalizations, and so forth. And so nobody should be confused by that. Masks remain essential. In fact, as I mentioned earlier, the vast majority of people in Louisiana today can't go get a vaccine. You can't. It's just not available. We don't have the supply. But you can put a mask on. And it is essential that you do that. And it is probably more essential than ever if you look at our current numbers, and you look at those numbers in the context of what we are being told to expect, again, by the CDC, that this new UK variant could be the dominant strain in Louisiana and around the country as early as March. It is 50% more transmissible. And when you look at the high baseline that we're at right now, first of all, we need to get that as low as we possibly can. You can only do that by wearing a mask. But if you look at that high baseline where we are right now, and then you think that over the coming weeks, we're going to have a strain that is ever more prevalent in Louisiana and elsewhere, that is 50% more easily transmitted, then you know that we need to be wearing masks. And I don't, for the life of me, understand how wearing a mask, despite the CDC recommendation, despite what was coming out of the White House Coronavirus Task Force every single week, that some people developed an opposition to it and kind of base that on political ideology, or it just never made any sense to me, still doesn't make sense to me. That virus doesn't know or care whether someone who wears a mask or doesn't wear a mask is a Republican or a Democrat or independent or who they voted for. I mean, that just, the idea that happened here and around the country just doesn't make sense to me. But no matter how we got to where we are today, it is never too late to do the right thing. The right thing is to wear a mask. It is how we are a good neighbor to one another in the middle of a pandemic that is obviously deadly. We reported 41 deaths today, 59 yesterday, 59 the day before that. I mean, just look, and quite honestly, it's not a very onerous thing to do. So I encourage people, no matter what you've done up to now, put on the mask, and let's get through this together with the least loss of life possible. So if we'll do this, we're all gonna be better for it. I do want to thank the people of Louisiana for the work that they've done thus far. Encourage those who haven't been quite as conscientious to do better, and let you know we're going to do everything that we can moving forward to ensure that we preserve our hospital capacity for life-saving care, minimize death, and speed the number of people who are able to receive vaccines in these priority groups. And we'll have more information for that on that for you next week. And until then, you'll be able to see on the dashboard the COVID, the state of COVID, and the state of vaccinations across the state of Louisiana. I do want to thank all the people at the Department of Health who are putting the effort forward to make this information available to the people of Louisiana. And I also want to thank all of our partners across the state of Louisiana who are actually making those doses, those vaccinations happen so that we have something to report on. I continue in many, many ways to be inspired by the people of Louisiana who are good, honest, decent people. And they want to be good neighbors and do their part. And if we could all do that, if we could all embrace that, then we're going to be much better for it. Thank you all very much, and I'll talk to you next week.
Into loyal